As a group, we chose the Wear a Mask campaign by the American Hospital Association. The purpose of this campaign was to offer resources on proper mask wearing practices in addition to advice from health leaders to better equip our nation with information they need to keep themselves and their family and their communities safe. The ultimate goal is to keep everyone in America safe. Why wear a mask? The context of this campaign stems from the COVID-19 pandemic. In December of 2019, one of the first cases of coronavirus was detected in China. On March 11th, 2020, the World Health Organization declared it to be a pandemic. And over the course of these years, we've lost over 2 million people to the coronavirus. So the American Hospital Association really wanted to educate the community and Americans on how to better protect themselves from the coronavirus and how to protect their communities and keep them safe. The American Hospital Association's ultimate audience was the American people. Anyone of any age was being impacted by the coronavirus. Families, friends, children, adults, elderly, no one was safe. And their ultimate objective was to stop the spread. They wanted to make sure that everyone was protecting themselves and others from the coronavirus. The American Hospital Association used a variety of delivery methods to educate the American people about the importance of wearing a mask. They used flyers, social media posts, videos, radio broadcasts, commercials, and just standard videos. Many of these videos and posts were in both English and Spanish. One of the examples that was used on a social media post was, "We all want to get back to the things we love to do. Help us get there by following the CDC guidelines, wearing a mask, and getting the COVID-19 vaccine. Hashtag wear a mask." This is just one of the many examples of the types of things that the campaign used to educate and to promote the mask wearing campaign.
As you may recall, many or several health agencies suggested and recommended that the public take certain personal protective measures for the safety of our friends, our neighbors, our families, our communities, and ourselves. And one of those suggestions was to wear masks. Soon it became mandatory to wear masks to enter many, if not all, facilities. The mask mandate campaign. My ears are still recovering from having to wear a mask for so long. Maybe you've seen this video or ones like it attempting to reach as many people as possible to inform, to guide, to educate, and to encourage the use of safe practices to the public. The mask mandate campaign enacted adult learning principles such as the principles learners need to know, the why, the what, the how of the mask mandate. What do I need to know? Why do I need to know it? How do I prevent it from affecting me? Things like, what is a COVID-19 virus? Why are there so many precautions? And how do I go about protecting myself and my family from this virus? Another principle of the learn is the self-concept, the self-directing and attempting to attain information pertaining to and understanding the mask mandate. Another principle is the orientation to learn. It's problem-centered, analyzing or determining the contextual information regarding the mask mandate. The last learning principle I'll bring up is the motivation to learn. It's the personal payoff. So what is it, what's in it for me? What are the benefits to complying or not complying to the mask mandate? Another thing that I would like to add is during the COVID-19 pandemic and with the mask mandate campaign, They required adults to use their critical literacies in evaluating, analyzing, researching, and cognitively determining the validity, reliability, and relevance of the information being shared through numerous outlets, such as TV, newspaper, social media, word of mouth, and many others. There were times of information overload, and adults had to decide between the benefits and consequences to potential exposure when having to be in a public setting, even if they were following a mass mandate. I hope that you've enjoyed this presentation and possibly gained some insights as to how the events and experiences we have as individuals, families, communities, and as a country involve adult learning principles and critical literacy. I want to thank you for your time.
The campaign was interactive in many different ways. It had numerous videos and posters for all ages and nationalities. Some of the posters refer to what we love the most, for example, music, birthday parties, or even for the love of coffee with mom. The campaign was shared in many different social media platforms, for example, Facebook and Instagram, and also Twitter and LinkedIn. The campaign also focused on the heroes, the nurses, the doctors, and the EMT providers that help the nation. The campaign also focused on the importance of following the CDC guidelines, wearing a mask, and getting a COVID-19 vaccine. It also had information about the importance of covering your cough and sneeze, maintaining social distance, and washing your hands.
When designing a website, there are 4 critical design principles you need to consider in order to meet ADA requirements. The content should be perceivable, operable, understandable, and robust. In order for the content to be perceivable, the most important aspect is that we not assume everyone immediately understands the message the site is trying to convey. And sometimes this means you need to write information at its most basic level. Perception also means individuals with visual, auditory, or cognitive disabilities are allowed the ability to absorb the content through the use of assistive technologies such as screen readers. Therefore, images should include descriptive alternative text and audio descriptions, and video should include closed captioning. Appropriate color contrast is also incredibly important, as poor color matching can skew images, and lack of consideration in text coloring can hinder the use of assistive technologies. Making the site operable means it's easy to navigate. The screen should be able to be manipulated by a voice controller or keyboard. For example, pressing the spacebar advances the screen to continue recording, and pressing the home key would bring the page back to the top. Different sections of the site should be appropriately labeled with a header and supportive text readable to both the eye and assistive devices. And a menu with selectable options should be easy to find, understand, and allow for users to jump to specific sections. Content should not be flashy, that in a way which could induce seizures or other physical reactions. When embedding other software or tools such as links or PDFs or media, they need to be embedded in a way that allows them to be opened using assistive technologies. Making a site understandable means the content is laid out in a logical and predictable way with a clear flow, and it should be free from mistakes and again laid out in a way that is appropriate for use of assistive devices. If forms need to be filled out, the forms need to include defining text so individuals using screen readers can identify what information is required in each text box. It is also helpful if text can be translated into many different languages to serve multicultural populations. And in terms of making a site robust, it is important to include many forms of media to reach your audience's attention, but making sure that they are done so in a way that is appropriately presented, readily available for assistive devices, and that you're using the most current technological tools. Upon entering the American Hospital Association site, specifically the Wear a Mask campaign, I did immediately notice that the site was able to be navigated with my keyboard. What I was unsure of, though, is who the intended audience was for this site. To me, it would appear that this site is actually designed for healthcare officials and organizations, providing them with tools and messages that they can use on their own platforms. But if I was an individual looking for information on how to stay healthy and the importance of a mask, I might find that this was a reputable source and take it at face value. Right at the top of the page is a message urging people to get the COVID-19 vaccine. And while that is an important aspect of reducing the spread of COVID-19 and staying healthy, the site does not immediately call out wearing a mask, the benefits, or even where individuals can obtain personal protective equipment. It is then followed by a cute video with a mask featured in the center, and seen here is For the Love of Live Music, and the mask folds into a guitar. It is then followed by For the Love of Birthday Parties, and the mask folds into a party hat. There are no spoken words, therefore closed captioning is not needed. However, I'm uncertain how this would be read by a screen reader. And again, the video does not produce any information on how the mask relates to people who love live music. When I click this spacebar to drop below the video, there are two links to shareable videos of that version, one in English and one in Spanish. No additional languages were available. And then below that is a digital toolkit, which is a PDF that has a multitude of different resources for social media messaging and other branding and images. And it wasn't until the third and fourth pages that I did find actual websites that you can obtain information on the importance of wearing a mask, data around how masks have prevented and reduced the spread of COVID-19, and where masks can be obtained. And then there's also downloadable public service announcements. To me, having that information buried so deep within an embedded PDF does not seem to be accessible. And even below that, at the bottom of the landing page for the Wear a Mask campaign, there are spotlight resources that does have downloadable digital imaging, videos, and other elements of the Wear a Mask campaign. However, the spotlight resources, I'm not sure that that would be easily accessed through a screen reader or other accessible devices. And then below that, messages, which users can copy and paste or download. This is at the bottom of the page, and it is the only spot on the landing page that does specifically mention the importance of wearing a mask. Now, there were a few things on this site that were done well in terms of accessibility, such as being able to navigate using the keyboard. However, there are some really important aspects that could have made this even more accessible, such as boldly highlighting the importance of wearing a mask at the top of the page, given this landing page is a campaign for wearing a mask. Along these lines, data should have been readily available to show how wearing a mask has reduced or prevented the spread of COVID-19, and there should be resources available for users to obtain PPE or at least find out where masks can be purchased. Again, it is unclear if this website is intended for general public to gather information around COVID-19, such as mass vaccinations or other important information, or if it is used to help healthcare officials and organizations in their own campaigns to fight the spread of COVID-19. So there should be an indication closer to the top of the page with intended audience for the site. And while using images and videos are a great way to reach audiences who learn and process information differently, or maybe are at different stages of ability, it's imperative that sites only use multimedia when it can be used by assistive devices. The site itself, as well as the tools and resources offered, should be available in multiple languages, or at least with the ability for users to manipulate the content and translate into the language of their choosing. And when embedding additional links or resources, limit the number of required clicks it takes to access what you need. It should not take 4 clicks to open and download an image.
As we explained earlier, adults are unique learners with specific characteristics that influence how they learn. They are self-directed and prefer learning that is relevant to their needs. Additionally, adults bring a wealth of experience to the learning process, which can be leveraged to enhance their understanding of new concepts. They are also more motivated to learn when they see the immediate applicability of the information. Understanding these characteristics is critical in designing effective educational campaigns for adults. So, how could the American Hospital Association Wear a Mask campaign be more effective? One such way is through storytelling. By incorporating real-life stories and testimonials from adults who have experienced the benefits of wearing masks. This connects to adult learning theory by making the learning experience more relevant and engaging. For example, sharing stories from healthcare workers who have seen the impact of mask wearing in reducing the spread of COVID-19 in their communities. Adults are more likely to be motivated to learn when they see the direct impact of the information on their own personal lives. By sharing stories of real people who have benefited from wearing masks, the campaign makes the concept of mask wearing more relatable and encourages adults to see the importance of this behavior in their own context. Another approach is to provide practical tips. Offer easy-to-follow guidelines on how to properly wear and care for masks. This approach aligns with the principles of andragogy, which emphasize the importance of practical, problem-centered learning. Adults prefer learning that is relevant to their needs and that they can apply immediately. This includes sharing information on the different types of masks available, how to properly fit a mask, and how to clean and store masks. Providing this information can help to alleviate any confusion or uncertainty that adults may have about wearing masks, and helps the campaign meet the needs of adult learners by offering actionable information that can be easily implemented into their daily lives. Offering incentives is another way to make the campaign more effective by providing rewards or recognition for individuals who demonstrate consistent mask-wearing behavior. This reflects the principles of self-directed learning, which emphasize the importance of adults taking responsibility for their own learning. Adults are more likely to engage in learning activities when they see the direct benefit or incentive. By offering rewards or recognition for consistent mask-wearing behavior, the campaign encourages adults to take ownership of their health and well-being and motivates them to adopt mask-wearing as a regular habit. Adults learn best through hands-on experiences, and experiential learning can be supported by providing opportunities for adults to engage with the content in a meaningful way. Utilizing multimedia through the creation of videos, infographics, and animations that visually communicate the importance of mask wearing, such as this one below. Videos such as this one within the campaign allows adults to visually experience the benefits of mask wearing and understand the importance of this behavior in the prevention and spread of COVID-19. It helps to engage adults and reinforce the message of the campaign. Providing resources is another way to make a campaign more effective, such as this. Offering resources for adults to learn more about mask wearing and COVID-19 in and of itself. This supports self-directed learning by empowering adults to seek out information and resources that are relevant to their needs. Self-directed learning theory suggests that adults learn best when they have control over their learning process. By providing resources for adults to learn more about mask wearing, the campaign enables adults to take control of their learning and make informed decisions about their health and well-being. Overall, the Wear a Mask campaign has the potential to be highly effective in promoting mask wearing among adults. By applying adult education principles and theories, such as andragogy, experiential learning, and self-directed learning, the campaign can effectively address the unique needs and preferences of adults learning. Andragogy's focus on problem-centered learning ensures that the campaign resonates with adults by highlighting real-life scenarios where mask wearing is crucial. Experiential learning principles enhance engagement through interactive elements, allowing adults to learn through experience. Self-directed learning empowers adults to take control of their learning, making the campaign more personalized and meaningful. By understanding and applying these theories, the campaign can effectively promote mask-wearing behavior among adults, contributing significantly to the fight against COVID-19.